Well, let's talk to Senior Consultant in Communicable Disease Control at the University of Exeter, Dr. Barat Pancanya, about that statement by Sajid Javid. Barat, very good to see you. Afternoon.
Good afternoon.
I put it to Norman on a political level, but is having perhaps what could be perceived a more gung-ho health secretary going to change the following the science mantra?
I hope that Sajid Javid, after he has been briefed by the scientists, etc., will take a more measured approach. So I was very disappointed to hear what he was saying, which was, this is irreversible. That is a wrong narrative, because there will be times, there will be incidents, there will be events where we will have to have some restrictions somewhere in some place. So to give that message that it is irreversible implies that after a certain day, all control measures, all infection control measures end. That is just not possible.
So we have a situation then today, over 22,000 new cases. That's a change in the situation from your perception and concern.
It is, and you see, I get intelligence from my colleagues, and they say to me, slowly, the beds are filling up, and some of them have already been fully immunized, and yet they are in hospital. This is the vulnerable group. So, of course, we have to tread carefully. We have to tread in a measured way. I'm not asking for a permanent lockdown, but for a minister to say it will be permanent removal of restrictions gives the wrong messages.
But the vaccine rollout is proving to be very effective, particularly against these new variants. So obviously nothing today, but it is clear that many rules will go in 2 weeks. Are we jumping the gun, though?
We need to be cautious and let's see what happens. But the vaccines have been our lifesaver. They are saving lives, they're protecting people, and therefore what we need to do is immunize as many as we can, as fast as we can. And unfortunately, we will also need to have consideration for boosters, and we also need to think about the younger age group, if we can get supplies to immunize them.
Why should we be worried? Barat, sorry you talk about the younger age group. Why should we be worried about the younger age group, who seemingly appear not to be so badly affected by COVID? Why not let them just get it but not be seriously ill?
Now, there are several reasons, so let's take us through it. So one, they can get infected. Number two, they can get long COVID, and we don't know how long COVID lasts. In other words, it's a disability lasting for how long, we don't know. Secondly, a variant could arise at any time, at any moment, which causes severe disease in the younger age group. And therefore, if you have been immunized, it may possibly protect you against such a variant. And one more thing, an immunized person is less infectious to others, so they stop driving the infections in the community. So all those reasons are very valid for immunizing the younger age group. It's not a case of they suffer mild illness, therefore don't bother immunizing them.
Just very finally, and I don't want to draw into politics, but what about confidence? A health secretary has gone now for breaking his own rules. How can the government expect anyone to follow them now, just briefly?
Very difficult, and I hope, therefore, the new Secretary of State will set the parameters and say we need to work on this together. I always say, let us work together as one government, coalition government, on the pandemic.
Dr. Barat Pancanya, thank you very much indeed. A pleasure to talk to you live here on RT UK. Good to see you.
Thank you.